Every day we are learning new potential symptoms of the coronavirus. This time it appears that even our toes could tell us whether or not we are infected. Researchers have observed a new possible sign of coronavirus in the body. Here's what we know so far. According to USA Today, some health professionals treating COVID-19 have noticed purple and blue lesions on the toes of coronavirus patients. This symptom is now being referred to as COVID toes and can often be observed in patients with severe flu or viral pneumonia. Ebbing Laudenbach, chief of infectious disease at the University of Pennsylvania School of Medicine, told USA Today that the symptom could be an inflammatory reaction to an infection in an individual's feet or a clot in the toe's blood vessels. Laudenbach said patients exhibiting this symptom tend to be children or young adults who are otherwise asymptomatic and would probably test negative for COVID-19 as the infection is in its early stages. However, Susan Wilcox, Massachusetts General Hospital's chief of critical care for the emergency department, told USA Today that she mostly observed COVID toes in the most severe cases she was treating. Doctors around the world have also observed other dermatological symptoms related to COVID-19. In an April 6th press release, France's National Union of Dermatologists-Venereologists reported that certain dermatological conditions could be related to COVID-19. These include the appearance of pseudo-frostbite of the extremities, transient hives, and sudden onset of persistent, sometimes painful redness. Here are some other symptoms you should be watching out for. Chinese scientists have identified a pattern of day-to-day symptoms typical of patients with coronavirus in a new study. Their study, published in the journal JAMA, looked at 138 patients hospitalized with novel coronavirus-infected pneumonia at the Zhongnan Hospital of Wuhan University. According to the study of patients in Wuhan, fever is typically the first symptom experienced by those infected with SARS-CoV-2, the virus that causes coronavirus disease 2019. Some COVID-19 patients may also experience fatigue, muscle pain, and a dry cough. By day 5, this transitions into breathing difficulties, especially for the elderly or those with pre-existing health conditions. The study found it took patients an average of 7 days after running a fever before they were admitted to a hospital. By day 8, those with severe symptoms had developed acute respiratory distress syndrome, or ARDS, which can be fatal. This is when fluid builds up in the lungs. Patients with worsening symptoms are typically admitted to the intensive care unit by day 10. These patients are probably experiencing more abdominal pain and loss of appetite than those with milder symptoms. On average, it took patients with COVID-19 roughly 2.5 weeks to recover from the illness and be discharged from the hospital. According to CNN, as of March 19th, there were 215,000 coronavirus cases globally. The death toll has surpassed 8,000. Countries such as Argentina, Canada, and Taiwan, as well as the European Union, have shut their borders in order to slow the spread of the disease. The coronavirus has officially taken over the world, and information about how the virus works, spreads, and affects humans seems to be changing by the minute. Here is what we know so far. According to a report by the Associated Press, the coronavirus spreads when a healthy individual breathes in respiratory droplets that are expelled by infected individuals. Research by American health officials and experts published in medRxiv shows that the novel coronavirus can survive in air particles for 3 hours. It was also detectable on copper surfaces for up to 4 hours, on cardboard surfaces for up to 24 hours, and on plastic and stainless steel surfaces for up to 2 to 3 days. An individual carrying the virus can infect around 2 to 3 other people, making it more contagious than the flu. However, coronavirus spreads less easily than measles and tuberculosis. Early symptoms include a fever, a dry cough, and difficulty breathing. Recovery takes about 2 weeks. People carrying the virus seem to be the most contagious a few days before showing symptoms. Older adults and individuals with underlying health conditions are at risk of experiencing more severe symptoms of the virus. It goes without saying that the best way to deal with this virus is by putting your introvert cap on for a couple of weeks. Binge watch that docuseries you haven't had time to see.
Marie Kondo your entire house. Finish that at-home workout program you keep postponing, and for the love of God, wash your hands and stop hoarding toilet paper. For more news animations and explainers, hit the subscribe and bell button to join the Tomo News family. Thanks for watching.